patient is left side lying, dorsal recumbent, and right side lying. That's the best thing that you have to remember. Pero pag low cleansing enema, ang gina-focus nila is sigmoid and descending colon. Descending colon. So pag descending colon, ang position mo lang dyan is left Sims position. No? Left Sims position lang. Alright. Next. When the patient is complaining, initially the patient complains initially when the patient is complaining about cramps lang man, initial cramps, okay, you need to stop and return when cramps is gone. When cramps are gone, so stop muna kasi initial lang man na siya, normal lang na siya na mag-adjust ang imong intestine. But if there is severe cramping na talaga, you need to stop the procedure and notify the physician. Next. So the answer is dog. The nurse starts to experience pain while receiving an edema. The nurse notes blood and return fluid and rectal bleeding. There is a return of blood and fluid, so that should not be. So administer, no. Slows down and rate, no. Tells the patient to breathe, no. Stops, yes, correct. 76. There is healthy breathing, gas exchange. Maintain patent airway. Client most recent problem with the transport. Ito na yun. Pag walang tricycle, walang rela, anong mangyari? May shortness of breath. That's why may anemia. Very good. So, mababa ang RBC. So, that demonstrates the knowledge of proper use of incentive spirometer. Okay, what is incentive spirometer? Incentive spirometer, it is a device. Well, incentive spirometry, iba yan. It is a procedure. Okay? It is a procedure, while the other one is a device. Okay? Device. So now, when I say device, yun siya, ang itsura niya na parang may ganito. Ayan, and then, ilalagay yan sa bunganga ni patient. Yung bunganga ni patient, mag-blow siya. Then may ball yan dito, may mga grade yan siya. So the purpose of this one is to re-inflate the lungs. No, re-inflate the lungs. But remember, do not push the patient to let the ball up here after surgery, because that would not happen. If you will force the patient, forcing patient to make the ball up, it will lead to what you call atelectasis. Okay? Iniiwasan natin na magka-atelectasis ang patient. So, but then you push the patient to put the ball up, then magkakaroon ng atelectasis or rupture of the alveoli. Hindi ang lungs nag-rupture, alveoli lang. So, what is the answer? I should inhale slowly and steadily to keep the balls up. Okay, that's it. Nurse Lalaine is performing oropharyngeal. Okay, pag oropharyngeal suction, anong turo ko? Anong gagamitin? Clean or sterile? I-clean lang po yan kasi oropharyngeal. May measurement ba tayo? Wala po tayong measurement dyan. Kasi nga, nasa mouth lang naman siya. Now, ang gagawin natin dito is, when the suctioning procedure, class, remember, on suctioning, we remove the secretions in order not to have an effective airway clearance. So suctioning is very important to remove those secretions. But before that, we need to make sure that you auscultate lung fields. So kung may mga crackles na yan dyan, that's the time you need to perform your suctioning. So if there is no crackles, then do not perform. Baka magkaroon ng problem patient na hypoxia. So when you determine that there is crackles on the lung field of the patient, you start now your oxygen delivery. Okay? So if it is a ventilator, set up the ventilator to FiO2 niya to 100%. If it is an oxygen tank, dapat ang kanyang is 10 liters per minute. dapat anong tawag mo dito, Nurse Jane? Hyperoxygenation. So before ka mag-perform ng inyong suctioning, i-hyperoxygenate mo muna ang patient because lagyan mo ng hangin, maraming hangin. Bakit? When you do suctioning, sinusuyop niya ang hangin. So, tendency ang patient magkaroon ng hypoxia later. So, kaya nga, ang least time to do the suctioning is 5 seconds. Best would be 10 seconds. And then, the least could be, the maximum is 15 seconds. More than that, it will lead to what you call hypoxia. And, remember, do not perform suctioning while insertion. Okay? Walang nag-suction while insertion. Nag-suction kita upon withdrawal of the catheter on rotational motion or circular motion. Okay, let's continue. What number we now? Okay, that's it. Now, this is all about 79. Oh, smoker. This is result 7.35, 70. Oh, PCO 255. Bicarbonate 32. Alright, let's go. For sure, hindi nyo pa alam yan. I don't know kung alam nyo na ba. Remember the Rome? Okay. So, we have your pH. And then you have your carbon dioxide, PaCO2, and then bicarbonate. Ito ang tandaan mo. Basta mag-answer, gusto mo i-answer ang RESPI, make sure we're talking about carbon dioxide problem. If you want to answer metabolic, that is your bicarbonate. Wala namang carbon dioxide sa tiyan. Okay, nakatira. Wala. So, pH natin, normal, 7.35 to 7.45, while the partial carbon dioxide is 35 to 45, while the bicarbonate is 22 to 26. Now, okay. So, pag ang pH mo gani magbaba, if pH magtaas rather, and then ang carbon dioxide mo kasi hindi sila friends, magbaba si carbon dioxide. So, dito pa lang, you got your respiratory alkalosis. Now, if your bicarbonate, nagtaas po siya, kasi taas man si friend niya, okay, nagtaas si bicarbonate, magbaba dapat si bicarbonate. Kasi nga, magko-compensate siya. Okay, magbaba siya dapat para mag-compensate si bicarbonate. Now, kung magbaba dapat si bicarbonate, dalawa na sila ang abnormal, 2 abnormals, diyan ka na magsasabi ng tinatawag na compensated. Dapat tandaan mo, dapat dalawa sila ang abnormal. Now, paano ko masasabi na partially and fully, Nurse Jane? Partially, class, if it is abnormal pH, then fully, if it is normal ang pH. Okay, so, if one is abnormal, either carbon dioxide, partial, or the bicarbonate is abnormal, either, or, the answer is uncompensated, kasi hindi nga nag-compensate ang isa. So, pag uncompensated na, huwag ka nang sumagot. If uncompensated, huwag ka nang sumagot ng fully or partially. Don't categorize to fully or partially. Kasi nga, uncompensated nga siya. Bakit magsasabi ng full, respiratory alkalosis, fully uncompensated. Lol. Hindi na nga pwede magsabi basta uncompensated na. Wala nang fully, wala nang partially pag ang answer mo is uncompensated. So, let's get the problem. So, what is 7.35? Oh, that is normal. But this PCO2 taas. O, acidosis na to kasi baba ang P. Bakit na yun acidosis ang answer? Okay, by the way, 7.35 and the 7.45 is the normal pH, isn't it? But there is a middle or mean average of it is 7.4. With regards to it, that lowers to 7.4 but in the normal range, ang tawag pa rin natin dyan is acidosis. Higher than 7.4 but within the 7.45, below the 7.45, that is alkalosis pa rin siya. Kahit normal pa siya, Pero nababa siya sa 7.4. Siya ang binabasihan natin ang 7.4. So, acidosis. So, question if it is compensated. So, if the carbon dioxide is above and the bicarbonate is above, meaning duwa ang abnormal, compensated respiratory acidosis. Oxygen therapy via cannula. Okay, when you are being asked about in the board exam, what is the most convenient oxygen device? That is your nasal cannula. No, nasal cannula, the most convenient device. 81. Clients with a chest tube drainage device. Okay, chest tube na naman tayo. Hemothorax. Okay, pag sinabing hemothorax, ano nga yun? Very good. That is a pleural effusion. Basta fluid nga, pleural effusion. Pero pag air, anong tawag? Pneumothorax. Mataas ang air, mababa ang water. Ang ulap ay nasa taas, ang dagat ay nasa baba. So pag second ICS, ang pinag-usapan natin dito, second ICS, anong dapat ang tatandaan pag sa second ICS? Alright, very good. Nasa pneumothorax po tayo basta second ICS. Pag fifth ICS yung tube, nasa pleural effusion. Now, remember, in a patient with both pleural effusion and pneumothorax, they do have what you call positive pressure. Kasi ang dapat na normal sa lungs natin is negative pressure. Walang ka-pressure dapat. But once there are fluids and air, this could lead to the pressure positively to the area kasi nga mag-effort si lungs na mag-inflate but it cannot. That's why when you do have this kind of problem, you do have a diminished breath sounds. So on the 81, the question is all about the chest tube drainage system. Anong nangyari sa chest tube? Main purpose of using the chest tube drainage system is to remove the blood in the pleural space. That is correct. Okay, the purpose of the thoracentesis and this chest tube, CTT, chest tube thoracotomy, is to remove those fluid in order for the lungs to expand again. 82. Certain procedures that can only be done by the nurse. Per doctor's order, Nurse Melody knows that some of these are following exam. Do not add fluids on the water bottle seal. Tatlo yan sila ha. Tatlo yan sila. When you say tatlo, this one, this is the drainage. Another one connected to the bottle. Okay, and then the other one is the suction bottle. There is a fluid here, remember, and immersed with a tube, diri ka mag-observe sa ginatawag na fluctuation. So, ang fluctuation class would indicate that there is what you call, kung lang fluctuation sa board exam, tidaling. Kung wala pa rin tidaling, you go with oscillation. Okay, oscillation. So this is the up and down of fluid dito sa up and down, up and down siya. So dapat makita mo yan, meaning to say patent ang tube. So once there is no fluctuation, on the first day, tendency may kink or na-block ang tube. Okay? So, ang makita mo bubbling diri class sa second bottle is not continuous but intermittent lang ang bubbling ha. On and off lang ang bubbling niya dito. Ang continuous ang bubbling is here on the third bottle. Continuous bubbling is normal on the third bottle. Magtaka ka bakit hindi nagbabubbles, baka na-turn off ang suction machine. So, check first the plug. Maybe natanggal ang plug kaya hindi na siya nagko-continuous bubbling. Alright. So, never add. Before collecting the stools, no. What number are we now? Here. Nurse Melody is assessing the functioning chest tube drainage system, which of the following expected client findings. Oh, drainage system. Alright. Mali. 2 correct. 3 correct. Rise and fall, the oscillation. No, mali. Exposed sutures without dressing, mali. That will lead to infection. No, it should be below the level. It's letter A, 2 and 3. Very good. A patient neglected their chest tube and accidentally chest tube. Oh my God, the chest tube is disconnected. Anong gagawin ni nurse? Exam. Instruct the patient to exhale fully. Yes, ang tawag doon na maneuver is Valsalva maneuver. Para magkaroon ng closure at hindi mapasukan ng positive pressure. Okay? Now, next would be, Nurse Melody is a primary care provider with a removal of a chest tube. So, anong sinagot dito ang exam? Apply pressure with the gauze at insertion site. Apply pressure with a gauze lang. It's a petrolatum gauze, not just a gauze. A patient neglected her chest tube and accidentally chest tube was disconnected from the bottle. From the bottle itself. Okay, yes, correct. From the bottle itself, not on the patient's surgical side. So letter C, letter D, dog. And always remember that on the bedside there you will be always stir the bottle as in case that the bottle will be broken. Nurse Melody assisting the primary care provider with removal of the chest tube. She instructs the client to, ayan na, Valsalva maneuver. 86. Priority nursing intervention to promote sleep for hospitalized patient. Avoid awakening patient and non-essential tasks. Correct. So especially patients are being hospitalized, they need to have a rest and they do need a what's called a noise to the area. So observe silence in it. Be professional in dealing with the patient. If there are folks or family members that are insensitive to the needs of the patient, you have to tell them to please go out and stay outside because the patient needs to rest. That is your right to tell the family members. 87, which statement made the mother being discharged to home with her newborn infant indicates need further teaching. My grandmother told me that babies sleep better on their stomachs. Wrong. Mali. Hindi pinapoprone ang baby na bagong panganak palang newborn infant. Letter C. 88. The nurse is developing a plan of care for a patient experiencing narcolepsy. That is what? Sudden sleep. No, maybe it will be put a danger to the head of the patient. It will cause an injury. So I think you need to instruct the patient to wear a helmet. The moment that they're going to do a travel, so you need to wear a helmet on this one. Promote safety. Okay, and at the same time, when they're going to travel without any helmet, tell them to encourage you to sleep. At least 30 minutes. No, 30 minutes, 20, 30 minutes. Okay na yan. Siya, power nap na yan. Letter D, dog. So, one of her patients in the ward, Roger, asked the nurse if he is already experiencing insomnia. Insomnia naman is a problem of sleep, which there is, you're about to what? You're about to, you are sleeping, but sudden awakening, and then it's hard for you to sleep back. That is your initial insomnia. But if there is a terminal insomnia, you wake up. Initial insomnia is all about nagising ka and then matagal kang makabalik ng tulog. Pero what?
No.
Oh?
Yeah.
Oh. Hello?
No.
Okay.
Yeah.
All right. Now, so number a term used to describe a prolonged inadequate quality. Yes, okay. Let's go with the sleep. Your sleeping pattern class goes with NREM1. This stage easy to arouse yan siya ha. So pag may sunog, makakagising ka. NREM2, non-rapid eye movement. So meaning to say your eyes are not moving. The eyeballs. You will see that the patient sleeping, their eyeballs are not moving, meaning to say they are on the NREM. The NREM2, this is all about your light sleep. Okay, and the NREM3, this is a deep sleep. Dito na kayo nagkakaroon ng somnambulism or sleepwalking. Dito kayo nagkakaroon ng non-clear dreams. Yung mga damgon ninyong hindi matandaan, that is happened on NREM3. Pero sa rapid eye movement, dito na yung nag-move ang eyeballs, nag-smile, kakatulog ka. That is what? Easy to arouse na rin din yan siya. Kaya gisingin mo ang tao nagagalit sa iyo. Katindot sa damgo ko, bro. Gibdom ko. So there is a clear dreams na siya dira. Okay? Dreams are already vivid. When I say vivid, meaning clear na. Okay, so to promote sleep, nurses encourage others to what? To drink what? Milk. Okay, drink milk, not coffee. Not coffee because it stimulates. Alright, stimulate. And do exercise, but not too heavy. Do exercise to promote sleep, not too heavy. You cannot sleep if it's too heavy. Why? If it's heavy exercise, there is increased circulation of blood now to your brain, so it stimulates your brain to wake up. Okay? And to promote sleep, you have to make sure you do have what you call calm environment, no? Calm environment for the patient. And sometimes doctors, those people, they will be given a sedative or hypnotics para makasleep lang sila. Number what na tayo? 90 na. Okay? 90, warm milk. O kasabi ko lang, why it's in the milk? Because in the milk, it has what you call L-tryptophan. L-tryptophan. So pag may L-tryptophan, that is an amino acid that will stimulate sleep. 91. Documenting the care delivered to the patients. Okay. Remember, here we go. There's a question in the board exam. How could a nurse escape from accountability? Accurate documentation. That is very important. Accurate documentation is the hallmark of accountability. Pag sinabing hallmark of accountability, that is accurate documentation. Now, so in order for you not to be having a problem in the court someday, make sure you document your chart properly. Okay? Now, so what else? Documentation reflects individualized care based on assessment data. Correct. 92. Passive variance has occurred with one of the patients. Which information provided the nurse would support this statement? Okay. So the patient's fever dropped dramatically and sooner than expected. Okay. So there are two types of decreasing the fever, the crisis and the lysis. The crisis is sudden while the lysis is gradual. Okay? The normal decrease of your temperature class is 1 degree Celsius in 1 hour. If you're gonna have 15 minutes, in 15 minutes, there's already 1 degree Celsius, this will damage the hypothalamus. Okay? Kaya nga hindi dapat ka gamit ng mga ice na mga bath, kay basi magbigla baba ang imo nga temperature. Unexpected events occur in the healthcare arena. When would an incident report need to be completed? Okay. When you do the incident report is very important, class. IR is very important for quality control. Why? So to prevent further damage for risk management purposes, okay, for the risk management and quality improvement, ginagawa ang ating IR. So quality improvement, that is your IR. So Nurse Jane, ano bang ka-importance ito? Well, first is you make sure as a head nurse, wala ka dapat na environment na blameful. Dapat blame-free environment para ang mga staff mo magsumbong sa imo at mag-report sila if there is an incident. So this IR class will help report it. Remember, when I say report, okay, it's not legal. So hindi mo ilagay yan sa chart ni patient, ha? Dapat naka-cover, naka-ano yan sa cabinet. And report that IR or give the IR to your risk manager. And that's your head nurse. So, when you do your IR, the incident that you found, yun lang ang dapat na, ilagay mo doon. So, for example, patient found lying on the floor. So, yun naman kasi nakita mo. The patient is drowsy and found lying on the floor. No. IR is just what you saw. Now, so to document an injury to a patient or a visitor, alright? Because in your quality control, may sinasabi ko, di ba? Discuss ko na yan. The near miss, the adverse effect, and what else? And then the sentinel. When I say near miss, almost, no? Almost pero no injury. While you say adverse effect, may injury na slide ang patient, nagka-fracture. Sentinel, napatay ang patient. Okay, napatay ang patient sa hospital. So, that needs to be attended by the quality control management. 94. Narcotic for patient respiration drop. Okay, because your narcotics or opioids class, or remember the opioids class or narcotics are respiratory depression ang side effect niya. So kung respiratory depression, before giving your morphine, make sure you check for the RR of the patient because it will suddenly drop the RR of the patient, and make sure you do have your naloxone as your emergency drug in case of that, or your Narcan as the antidote of your morphine sulfate. So the answer would be diluted 1 milligram IV cause RR 8, BP. Okay, very good. So letter C is the correct answer. Then notify the physician. Now, a patient with multiple sensory is discharged tomorrow after 3 weeks of hospitalization. Which statement describes the discharge planning for this patient? Yes. And should have what? Okay, should have been initiated shortly after his admission because your rehabilitation will start upon admission. Using the Maslow's framework, which statement characterizes the highest? Oh my God. Of course, that is your physiologic needs. So, the highest level is the self-actualization. The priority level is your physiologic needs, just to make clear things. Okay? I'm very proud of receiving an Employee of the Month award. So that is self-actualization. You have that achievement. The theories whose theory can be defined as the development of science of humankind, that is, Martha Rogers, the human scientific unitary human science of unitary human being. So that is Martha Rogers. Dorothy Johnson is behavioral theory. Imogen King is the goal attainment, and Martha Levine is for conservational principle. So the 98. It is because of this theory the hospitals and medical facilities, environmental by Florence Nightingale. Theories describes a significant therapeutic interpersonal process and functions, human process to make health possible in individuals and communities. Interpersonal relationship by Hildegard Peplau. According to the, okay, that is your self-care deficit. Sino yung si adaptation? Sister Calista Roy. So that would be all for today.